Good evening, everyone. Welcome to our program tonight, and thanks for joining us. I'm Dr. Cindy Russell, co-chair of the Environmental Health Committee for the Santa Clara County Medical Association, and this is the first of our 2025 Environment and Health webinar series. Tonight's presentation is Plant-Based for the Planet with Dr. Ulka Agarwal and Dr. Tamiko Katsumoto. Our next webinar will be on Tuesday, April 22nd on Earth Day, and Dr. Santosh Pandapati, our president-elect, along with our current president, Dr. Fad Khan, will be leading an expert physician panel discussion on the impacts of climate change and how physicians can address and engage in this issue. So stay tuned, that'll be a wonderful discussion. And on Tuesday, May 20th, we're going to be discussing getting the lead out. And this is going to be a discussion of the legacy of lead toxicity with Dr. Bruce Lanphier. He's a professor, researcher, and international expert on lead. And he's an excellent speaker. You're going to learn a lot about lead that you never even knew about. So you can register for both of those at the SCCMA homepage at events. Just want to remind you that you're going to be muted during the program, but we invite you to post your questions anytime in the Q&A box. We're going to take questions from our presenters at the end of the program. And we're going to try to post the resources during the program and at the Q&A, but if we're not able to do that, they will be available on the website. And I think our speakers also, we have a list of resources for you that will be available and can be sent to you. This program is being recorded and it will be posted on the SCCM website on the Environmental Health webpage, and you can see prior webinars on environmental health there too. So Dr. Ulka Agarwal is going to start, and she's going to explain to us why plant-based diets. Dr. Agarwal is a psychiatrist at California State University, East Bay. She's a graduate of Andrew Weil's Integrative Medicine Fellowship and has dedicated her career to understanding the relationship of nutrition to human and planetary health. She's published several clinical trials examining the effects of plant-based diets on mental and physical health, and has led plant-based nutrition education programs for students, staff, and faculty in a variety of settings. She earned her MD from the Chicago Medical School and completed her residency at the University of Washington in Seattle. She's an active member of the Santa Clara County Medical Association's Environmental Health Committee and has contributed valuable insights to benefit physicians, patients, and her community. It's been a pleasure to have her on our committee. Welcome, Dr. Agarwal, and thank you for speaking with us.
Thank you so much. All right, so why plant-based diets? Well, to answer this question, let's take a look at our current diet. In 1909, the USDA began tracking what Americans eat. And as you can see, meat consumption has been steadily rising since the 1940s, including red meat, poultry, and fish. But the sharp increase is mostly due to one type of meat. Can you guess which one? Chicken. Why? Because it tends to be cheaper and because people think chicken is healthier than red meat. And as a result, our chicken intake has more than doubled per person per year since 1980. Now, to put that into perspective, Americans now eat about 1 million chickens every hour. Our cheese intake has also almost doubled since 1980. We now eat over 40 pounds of cheese per person per year. Sweeteners have increased as well, mostly in the form of corn sweeteners. But in the last 25 years, sweeteners have actually decreased as Americans shift away from high fructose corn syrup. So we're eating more meat and cheese than we ever have. And despite having the most advanced medical system to date, we're sicker than we've ever been. Right here in Santa Clara County, nearly 1 in 3 adults have either diabetes or prediabetes, and 1 in 5 adults are obese. And heart disease is the #2 leading cause of death in our county. With these stark numbers, how do we get our health back on track? Well, one place to start is to study people who already follow a healthy lifestyle and see what we can learn from them, like Seventh-day Adventists, whose religious teachings include no tobacco, no alcohol, and no meat. The Adventist Health Study 2 looked at data from over 60,000 people, and here's what they found. The lower people's meat and dairy intake was, the lower their BMI, and the lower their risk for type 2 diabetes, even after adjusting for BMI and other factors. Another large study of 65,000 people found that as meat and dairy intake decreased, so did BMI for both men and women. And a 2023 meta-analysis and systematic review found that a shift from animal-based protein to plant-based protein, like nuts, legumes, and whole grains, is associated with a lower risk of all-cause mortality, cardiovascular disease, and type 2 diabetes. So, research shows that plant-based diets can lower risk for chronic illnesses and promote good health. And the Academy of Nutrition and Dietetics agrees. Okay, but why should we care about the health effects of plant-based diets? We're here to learn about environmental health, right? Well, because our pre-existing health status affects how vulnerable we are to climate change. And certain groups, like communities of color, have a higher risk of chronic medical conditions, making them less climate resilient. And the effects of climate change, like excessive heat and air pollution, in turn exacerbate pre-existing health conditions. So, to minimize potential impacts of climate change, we must address health inequities and improve people's health. That's why the American Medical Association wrote to the USDA, urging them to make meat and dairy optional in their federal nutrition guidelines and to offer plant-based milks in schools. Because meat and dairy have been linked to chronic illnesses and some cancers, which are disproportionately higher in communities of color. This year's Dietary Guidelines Advisory Committee was the first to systematically incorporate a health equity lens throughout its work. As a result, they recommended plant-based protein like lentils, beans, and peas over meat, and that water be the primary beverage for Americans. That's because 50 to 80% of Black, Indigenous, people of color, or BIPOC are lactose intolerant. But communities of color aren't waiting for the USDA to revise their outdated dietary guidelines. They're taking a proactive approach to their health. BIPOC are 3 times more likely to identify as vegetarian than white Americans. And a Pew study found that African Americans are the fastest growing group of plant-based eaters in the US. Shaquille O'Neal did a Got Milk ad years ago, but he's actually lactose intolerant, and so he became really sick while drinking milk for these ads. Then a few of his family members were diagnosed with diabetes, and he became concerned for his own health and actually reduced his dairy and meat intake. And then 5 of his kids did an ad for plant-based milk out of concern for their health. Santa Clara County also recognizes the connection between climate resilience and health equity. That's why their sustainability master plan includes a public health goal to reduce the prevalence of prediabetes in our county. And as we just saw, plant-based diets are an effective way to prevent diabetes and common co-occurring diseases like obesity and heart disease. So, plant-based diets promote health equity and boost climate resilience. But how do they actually affect the environment? Well, animal agriculture is a massive industry. Globally, more than 90 billion land animals are raised and slaughtered for food every year. This is a CAFO, or a concentrated animal feeding operation, also known as a factory farm, where as many as hundreds of thousands of animals are confined in sheds. For example, a single shed like this can hold 20,000 or more egg-laying chickens. Incidentally, you can see how quickly avian flu can spread. even for so-called cage-free eggs. And globally, about 75% of all meat, dairy, and eggs come from a factory farm. And in the US, it's 99%. As a result, our global food system is responsible for 1/3 of all greenhouse gas emissions, more than half of which are due to livestock. Why? Because of the deforestation required for animals to graze and to grow their feed, and the methane emissions, mostly from animal manure and cow burps. In fact, agriculture is the primary source of anthropogenic methane emissions, most of which is due to livestock. This is significant because methane is responsible for as much as 30% of all global warming. And because it's a short-lived yet potent gas, reducing methane emissions specifically can have a rapid and significant effect on climate change in the next decade. Now, eating local is touted as a way to reduce carbon footprint, but transport accounts for less than 10% of emissions from food. And that's because most food travels by sea, which emits about 50 times fewer emissions than air. Depicted here are the emissions of different protein sources of food. And as you can see, animal products are by far the highest emitters. Beef in particular at the top is the single food with the highest impact on the environment because of the vast amounts of land required for the cows to graze and methane emissions due to their burps and manure. In fact, greenhouse gas emissions from animal-based foods are double those of plant-based ones. But it's not just about emissions. The environmental effects of animal agriculture are massive and pervasive. About half of the world's habitable land is used for agriculture, mostly for livestock raising. As a result, animal agriculture is a leading cause of global deforestation, habitat destruction, and biodiversity loss, and a leading cause of water pollution. Factory farms, which have lagoons of manure, like this one, are a major cause of air and water pollution, affecting people living closest to them, who are disproportionately people of color. Animal agriculture is also a leading cause of eutrophication, where the runoff of nitrogen and phosphorus from factory farms causes ocean dead zones. Animal agriculture is also extremely wasteful. About 1 out of every 4 land animals raised for food never make it to our plates. That means about 20 billion animals will be raised for food this year, only to be thrown away. And not only are the lives of those animals wasted, so are the land, water, crops, and carbon opportunity costs that went into raising those 20 billion lives. To quantify the environmental effects of animal agriculture, let's take a look at the planetary boundaries, which outline 9 key processes influenced by humans that threaten the stability of our planet. Each process has a safety threshold, shown in green, beyond which our planet becomes unsafe for humanity, shown in orange. For example, the safety threshold for CO2 concentration is 350 parts per million. But we surpassed that in the 1980s. Agriculture has been the major driver of 4 of these planetary boundaries that are already beyond the safety threshold, and a significant driver to a 5th, climate change. And global food emissions are expected to increase by about 80% by 2050. In fact, food emissions are so significant that even if we decarbonized everything else, we cannot meet the Paris Agreement unless we eat less meat. Okay, but how much does eating less meat really help? Well, in a 2017 study, researchers found that not eating meat for 1 year is a high impact action for reducing greenhouse gas emissions. A year without meat beat out eating organic, composting, eating locally, and even reducing food waste. Using reusable bags rather than plastic bags is less than 1% as effective as not eating meat, and recycling is 4 times less effective. A meta-analysis from 2020 also found that plant-based diets are a high-impact action for reducing carbon footprint. To quantify this, a study published in Nature in 2023 analyzed data from 55,000 people. They found that as meat and dairy intake decrease, so do greenhouse gas emissions by as much as 75%, as well as land use, water use, biodiversity loss, and eutrophication. Now, these percent reductions are for a fully plant-based diet, but as you can see, any reduction in meat can have a significant impact on the environment. That's why the UN has consistently urged developed nations to eat less meat. And the UN's scientific body for climate change, the IPCC, has concluded in multiple reports that plant-based diets are healthier and better for the environment than our current meat-heavy diets. They even say the greatest shift potential for mitigating climate change is switching to plant-based diets. But in the IPCC's most recent synthesis report, there are no clear recommendations for plant-based diets. Why not? Well, prior to the publication of this report, documents were leaked revealing that some of the highest beef-producing countries lobbied to remove this powerful statement from the report, that plant-based diets can reduce emissions by up to 50%. They claimed there was no scientific evidence to support plant-based diets as healthy or sustainable, despite the IPCC publishing overwhelming evidence in their previous reports. But the statement was still omitted, so were any clear recommendations for plant-based diets. Instead, they used the vague term balanced and sustainable healthy diets. So even the IPCC isn't immune to the pressures of the meat industry. The US is no better, with a powerful meat and dairy industry subsidized by our government and our tax dollars. The USDA oversees what's called checkoff programs, whose main goal is to increase Americans' consumption of meat and dairy. That's right, our own government has a vested interest in every one of us eating more meat and dairy, the very foods that are making us and our planet sick. They do this by creating ads like beef, it's what's for dinner, and those got milk ads. To make matters worse, the USDA also creates the dietary guidelines for Americans, which is the primary advice Americans get on what to eat, and is a foundation of all federal nutrition programs, including school lunches. So on one hand, our government has a vested interest in Americans eating more meat and dairy. And on the other hand, we trust them to give us unbiased advice on what we and our children should eat. They even market meat and dairy through research grants and publications, making it even harder for Americans to know what nutrition advice they can trust. Even the EPA is complicit, as they don't even mention food as a way to reduce carbon footprint. And all this lobbying is working. Most Americans polled do not believe that eating meat affects climate change, which is especially concerning because Americans consume more than double the amount of meat than the rest of the world. So, what can we do about this? Well, eating less meat isn't the only approach to climate change. choosing sustainable options like regenerative agriculture can help. So can reducing food waste. So we should employ as many of these strategies as we can. It's not either or. We need all of the above. But the most effective approach to addressing climate change, no matter the sector, is to cut emissions from the source. The tub is overflowing, and we have to turn the faucet off. Regenerative agriculture isn't a replacement for reducing meat because it doesn't work by cutting emissions. Instead, it tries to balance them out by putting carbon into the soil. But as scientists have noted, it's not clear how much carbon the soil can actually hold or for how long. And regenerative agriculture can actually increase methane because cows live longer before they're slaughtered. And it still requires vast amounts of land. In other words, it's the cow, not the how. Overhauling a massive industry of over 90 billion animals and its associated policies and infrastructure will take years, if not decades, and lots of money. Eating less meat is something most of us can do today, every day, multiple times a day, at little to no cost. Okay, but what if we just swap out the cow for a chicken? Well, chicken emits about 5 times fewer emissions than beef per kilogram. So yes, you would reduce emissions. But it's not just about emissions, because to replace one cow, you need about 200 chickens. And as the number of chickens increase, so do the degrading effects on our environment, including deforestation, habitat destruction, biodiversity loss, air and water pollution, and ocean dead zones. Okay, then what about fish? Well, 50% of the seafood we eat is farmed. And as you can see, farmed seafood can emit more emissions than even pork or poultry. This is mostly due to the methane from their waste and feed. Farmed seafood is also extremely wasteful, as many as half of all farmed shrimp die due to disease. Wild-caught seafood isn't necessarily more sustainable either. 90% of fish populations are at or beyond sustainable limits, and 20% of what is caught is thrown away, including whales, dolphins, sharks, and sea turtles that get caught in fishing nets. The most impactful shift we can make to mitigate climate change and protect the environment is to eat less meat. So, how do we eat less meat? Well, the Eat Lancet Commission, a team of 37 scientists from across the globe, created a planetary health diet designed to promote both human health and environmental sustainability. They recommend 2 or fewer servings of animal products a day, while limiting dairy to 1 serving per day, red meat to once a week, and seafood, poultry, and eggs each to twice a week. Now, note that they didn't recommend a 100% plant-based diet because these are global recommendations, and some populations, because of where they live, may depend on animal protein. But one of the easiest ways to get started is Meatless Monday. For example, if everyone did Meatless Monday in the US, 1 day a week for a year, it would be like taking over 7.5 million cars off the road or saving over 90 billion miles. So how do you do Meatless Monday? Well, if you don't cook, you don't have to start now. Just start with the same meals you already enjoy, whether you cook or not, and just substitute the meat and dairy. When eating out, explore the plant-based options on the menu. And if you need meal ideas, Google is full of them. Now, as you explore plant-based meals, you'll likely come across the issue of ultra-processed foods. The concern is that plant-based meat alternatives, like Beyond and Impossible burgers, are ultra processed, meaning they contain manufactured ingredients or undergo too much manipulation to mimic the look, feel, and taste of meat. But are all plant-based meat alternatives necessarily harmful? Well, we don't really know yet. Some studies have made the headlines, but it's still an emerging area of research. So stay tuned. In the meantime, perhaps the best use of plant-based meat alternatives, if one chooses, is as a transition food on the path to a whole foods, plant-rich diet. Because yes, veggie burgers are certainly more processed than, say, a bowl of rice and lentils. But if you're at a diner or a barbecue or a baseball game, a bowl of rice and lentils is not the likely alternative. The likely alternative is a burger made from a cow, confined and slaughtered on a factory farm. But even with the right information and best intentions, it's still hard to reduce our meat intake, especially while meat remains the cultural norm and the easiest and often most affordable option. So we can't just put the onus on individuals. We need to shift the norm, especially where we work, because the healthcare sector accounts for 8.5% of all US greenhouse gas emissions. That's why the National Academy of Medicine recommends reducing food emissions as one of the highest impact interventions for hospitals and health systems. For example, in 2017, the AMA passed a policy calling on all healthcare facilities to provide plant-based meals, which inspired a California Senate bill that passed the next year. Over 130 hospitals have taken the Cool Food Pledge to purchase more plant-based foods, and all 11 New York City public hospitals offer a plant-based meal as the default dinner option, cutting their emissions by 36% and saving over $300,000. So, how can we do this? Well, the Cool Food Pledge is an easy and effective way for hospitals to reduce their carbon footprint. It's a pledge to reduce food emissions by 25% by 2030. And this is part of a larger goal to reduce food emissions by 67% by 2050, which is a target set by the Science Based Targets Initiative and is in line with the Paris Agreement. It's also a well-established program supported by the World Resources Institute and Healthcare Without Harm. The program provides structured support to participating hospitals. It has an affordable annual fee based on the size of the facility. And the program has a high retention rate with over 130 hospitals participating worldwide. And most importantly, it works. Hospitals are already halfway to their 2030 emissions goal. So, how do you get started? First, find your allies. Does your hospital or work have a green team or sustainability manager? Do you know anyone in dining or nutrition services? Or any decision makers who can make this happen? Then speak to their bottom line. Have they been tasked with reducing Scope 3 emissions? Are they looking to reduce costs, improve healthy dining options, or address health equity? Once you have your champion, have them fill out the Google form on this website. Once they've completed the Google form, someone will get back to them to get started. Currently, John Stoddard heads up the program, and he can be emailed directly with any questions. And we'll also share this link and all this information at the end of the talk as well. Once your team is signed up, Cool Food will send them a spreadsheet like this one to enter their food purchases from the last year. Then Cool Food will take that data and analyze it and send the team an emissions report like this one, outlining total food emissions and where they're coming from. For example, for this hospital, 4% of all food purchased for the year was from beef and lamb, but it contributed to 37% of total food emissions. whereas 24% of food purchased was from plant-based foods. But that contributed to just 5% of total food emissions. So you can see how decreasing animal foods and increasing plant foods can significantly decrease emissions. Cool Food will review the emissions report with your team and identify areas for improvement to help you meet your 25% emissions goal. They'll also help your team promote plant-based eating using proven behavioral strategies. Once these strategies are employed, Cool Food will recalculate your emissions annually to keep you on track. And as you progress, Cool Food will help your team share their successes. But if your hospital isn't up for the Cool Food Pledge, there are many other ways to make a difference. For example, when your department or office caters food, the main entree usually contains meat and dairy. So those who are plant-based or lactose intolerant have to request a special meal, which often still contains dairy. But what if you flipped it and made the entree plant-based by default, with an option to request a meat-based dish for those who want one? That way, you're prioritizing plant-based foods and promoting inclusivity without limiting anyone's freedom of choice. So, why plant-based diets? Because plant-based diets are a Swiss Army knife approach to environmental health. They allow us to effectively address multiple health and sustainability issues all at the same time. And given our current health and climate crises, we have no time to waste. Thank you.
Wow, that was fabulous, Dr. Agarwal. So much
Thank you.
information, a very honest discussion about it. And we have some questions about contacting you. You gave your contact information, so just fabulous. Wow, I'm sure everybody is we have resources to share for you that are put in the chat as well, but that was just a fabulous talk. Thank you so much. And now we're going to have Dr. Katsumoto speak. She's going to talk to us about communicating with patients about food as medicine. And Dr. Tamiko Katsumoto is a diplomat in the American Board of Lifestyle Medicine and a clinical associate professor in the Division of Immunology and Rheumatology at Stanford University. She completed her medical school, internal medicine residency, and rheumatology fellowship at UCSF. She's deeply committed to human and planetary health and passionate about educating her patients and colleagues on the merits of sustainable plant-rich diets as a strategy to both improve individual health and mitigate climate change and environmental degradation. She's fascinated by the impact of diet on inflammation and autoimmunity, and she's involved in several clinical trials at Stanford and has spent time at Genentech, where she led several global clinical trials in immunology. And thank you so much for presenting today, and it's wonderful to see that you are a rheumatologist and really involved in this issue of diet and inflammation. I'm looking forward to your talk. Thank you for presenting tonight.
Thank you. Thank you so much, Cindy, and thanks to Ulka, who also invited me to join. Ulka did a great job, hard act to follow. So I am at Stanford in rheumatology, and I'm excited to sort of speak about the practical applications of how I'm going to give tips on how I like to communicate with my patients about food as medicine. So what I'd like to cover today in the next half an hour is really touting the health benefits of plant-based diets. I think there's many of you in the audience who are physicians, so I want to highlight the role of physicians in addressing climate change, sustainability, as well as nutrition. I want to give you some practical tips and tricks, some strategies and resources to help promote plant-based diets, and then we'll end with some final thoughts. All right, so let's dive in. So I'm going to start with a clinical trial that came out last year. This is from Dean Ornish's group. I don't know how many of you saw this, but this was an incredible randomized controlled trial of intensive lifestyle changes in patients that had mild cognitive impairment or early dementia due to Alzheimer's. So they took 51 Alzheimer's patients, randomized to standard of care, versus a lifestyle intervention comprised of a whole food, minimally processed, plant-based vegan diet. They provided the meals, aerobic activity, at least 30 minutes a day, also with some mild strength training 3 times a week, stress management, including meditation, yoga, breathing, group support sessions, and supplements. So really speaking to the 6 pillars of lifestyle medicine. After just 20 weeks, they saw a significant improvement in some really standardized outcome measures, clinical global impression of change, clinical dementia rating scale, and there was an objective measure, the amyloid beta protein ratio showed improvement. So what can we say about this trial? I like to tell my patients that a whole food plant-based diet is actually an anti-dementia diet. I think that this is something that I think a lot of us are concerned about. We're hearing about Alzheimer's disease, and it's something that I think we are learning is more lifestyle dependent than we realize, with nutrition being a key pillar of the lifestyle intervention, along with these other 6 pillars. So keep that in mind. Hippocrates said, "Let food be thy medicine." I like to reference the blue zones. I'm not sure how many of you are familiar with the blue zones. There was a really nice Netflix series called Live to 100, based on Dan Buettner's book and research. And this basically speaks to 5 different locations in the world where they have the highest concentration of centenarians, people living to be 100 years or greater. The reason this is important is because you're never going to be able to do a randomized controlled trial for 100 years. And what was so interesting about these groups of people is they are 95 to 100% plant-based. So let's take a look at what they tend to eat. Here is the Blue Zone's diet pyramid. Again, 95 to 100% plant-based, lots of whole foods. One thing that all 5 of the Blue Zones had in common is they all tended to eat about a half to 1 cup of beans every day as their primary source of protein. 6 glasses of water, coffee, tea, wine in moderation, a couple handfuls of nuts a day. That was daily. And weekly, tried to limit their refined sugar to a max of 7 teaspoons, few eggs, less than 3 times a week, fish, maybe a maximum of 3 times a week. And then finally, monthly, they had meat less than 5 times, so approximately once a week at most. Dairy products, same thing. So very much a plant-based, plant-centered diet. There are so many health benefits of whole food plant-based diets. And so I'm going to skim the surface here, but basically there have been many studies showing decreases in all-cause mortality, including weight loss, favorable changes in lipid profiles, decreased risk, even reversal, I'll say that again, even reversal of cardiovascular disease, decreased risk of several cancers, decreased risk of diabetes and improved glycemic control for patients with diabetes, improved migraine symptoms. Who knew about that? And in the recent Netflix docuseries called You Are What You Eat, done by my colleague, Dr. Christopher Gardner, he took genetically identical twins and randomized one to a vegan diet and one to a healthy omnivorous diet. And the exciting finding is that the vegans showed slower aging. I thought that was really quite striking. There are numerous other benefits, not enough time and room to talk about them, but more and more studies are coming out regularly. So again, just to highlight, this is a small snapshot of the benefits. I do mention to my patients just a quick public service announcement reminder that the World Health Organization has declared processed red meats to be a group 1 carcinogen, meaning that there is sufficient evidence to support that they are carcinogenic in humans. And then red meat is considered a group 2A carcinogen, meaning there's limited evidence, but very strong mechanistic evidence for carcinogenicity. So I think it's important to mention that to our patients. And then I want to just sing the benefits of fiber. Fiber is something that we only find in plants. The current recommendations are that we get about 30 grams of fiber a day, but sadly, the standard American diet is very poor in fiber. In fact, the majority of people are getting less than 15 grams of fiber a day. So, to just tout the benefits of fiber, it is something that increases our satiety without any extra calories. So, simply by adding 14 grams of fiber to our diets a day, we end up consuming up to 18% less calories. So, it's actually a really great weight loss technique. I should mention that eating fiber increases GLP-1, and I think we're all very familiar with Ozempic and Wegovy. So, it's actually one of the natural ways we can actually decrease our hunger. It turns out that whole grain fiber increases our metabolic rate. It promotes the loss of calories in our stool, and many of us know that it improves motility. So again, people do not have constipation problems if you're eating plenty of fiber. It promotes the beneficial gut microbiome. And the way that it does this is that it basically allows the good bugs to ferment fiber and produce these wonderful metabolites that are called short chain fatty acids that are really important in maintaining immune homeostasis and keeping our immune system calm so it doesn't get overactive. We know that fiber also helps to improve our blood sugar response. We don't get the big spikes, glycemic spikes after eating a lot of fiber. And we know there's, again, lots of data supporting risks, reducing risks of heart disease, diabetes, and cancer. So you can imagine if you just ate, let's say, about 5 of these different types of foods a day, you would be getting your average amount, the recommended amount of fiber. One other thing that I just want to highlight, I'm actually becoming very interested in a lot of these environmental toxins. And there is, again, there needs to be more research in this area, but I think a lot of us are familiar with PFAS. These are the forever chemicals that seem to be present in a lot of different places, which have been associated with a lot of chronic diseases, just a few of them listed here. And there was a nice study that showed that, in fact, when they divided people using the NHANES database, when they divided people based on the amount of fiber consumed by quartile, you could see there was a progressive decrease in the amount of PFAS that was found in people's blood. So I think it's really interesting and provocative to think perhaps fiber is also helping rid our bodies of a lot of these toxins. Okay, question number one that I get asked by my patients all the time, but doc, how am I going to get enough protein? So I think it's really important to highlight that the average individual needs only about zero point 0.8 grams of protein per kilogram. That equates to 0.36 grams of protein per pound. So when you do the math, if let's say you're a 150-pound sedentary person, that's about 54 grams of protein a day. The needs may be a little bit higher for older adults, pregnant women, performance athletes, and children, but not much higher, maybe up to 1.2 grams. I will say I've heard a lot of debate on social media about what is that right target, but the bottom line is really for the average person who's not a performance athlete, again, this is a very, very reasonable target. And so what I want to show you here is this is from the American College of Lifestyle Medicine, showing a nice depiction of the amount of protein found in these beautiful food items like lentils and edamame, black beans, almonds. I added to that tofu and tempeh, which have really quite high amounts of protein. In comparison, you have your animal protein below, where you have to remember, even though there may be slightly more protein on a weight basis, it does come with saturated fat, cholesterol, things that are not the best for us. So just a reminder that if we were to shift from animal to plant protein, it lowers our risk for diabetes, for heart disease, for cancer, helps with insulin sensitivity, helps with our gut microbiome, and really overall promotes health. So again, just keep in mind beans and tofu and a lot of these other proteins are great, great sources. People say, well, but plants are incomplete. And the answer to that is not entirely true. That's not totally true because they actually have all the essential and non-essential amino acids. So I'm showing you a chart that shows here are the 9 essential amino acids on the left, and here are the 11 non-essential amino acids. And on the top section, you can see these are the animal foods, and below are all plant foods. And what's really striking is look at the distribution of amino acids. They're actually really similar across animal foods versus legumes, even grains. The key issue to point out is that maybe legumes a lot of them will have less methionine, and some of the grains may have less lysine. But if you imagine, we don't tend to eat just one item. We often tend to combine beans and rice, and by doing so, you end up getting a complete protein. So that is not an argument that we need to worry about. Okay, so what I'd like to talk about is some of the foods that we need to recommend that people add to their diet. Our a standard American diet is so full of refined processed grains. We're talking white rice, white pasta, white bread. And what we really need to shift towards are whole grains. These are grains that have not been stripped of their outer husk that has the fiber, which is so healthful. So keep in mind, just again, steel cut oats are very good. Farro, bulgur, brown rice, millet, even. So these are things that we should try to encourage our patients or our friends and family to eat more of. I like to highlight chia seeds and flax seeds because these are foods that are high in omega-3 fatty acids. I think chia seeds are one of my favorite foods because they're have high protein, high omega-3, and high fiber. So really wonderful thing to kind of add to our diets. Don't forget about fermented foods, which are the ones that have a lot of these probiotics in them that are very healthful. I'm just listing a few of them here. Someone in the audience asked a question about, well, what are the things we need to pay attention to really have a healthful diet? If we were to go, let's say, fully vegan. So, an important item is we do need to supplement with B12 if we are fully vegan or mostly vegan. I want to point out that a lot of elderly also should be supplementing with B12. People that are on a proton pump inhibitor, people that are taking metformin. So B12 is not something that should be exclusive to vegans. I think there's a lot of different people that should be taking B12 regardless. There are some nutrients of interest that I want to highlight. Omega-3 is one of them. I mentioned these chia seeds and flax seeds, calcium, vitamin D. We want to make sure we are getting plenty of this, and iron, zinc. And then, of course, if you're fully vegan, you just want to make sure you're paying attention to getting enough of the protein that you need. One thing that I do simply is I do take a vegan multivite, and that helps so that I know there's no issues with deficiencies. I want to point out that the majority of Americans who are omnivorous end up being deficient in fiber. They can also often be deficient in several vitamins, A, C, D, E, often not enough calcium, not enough magnesium, potassium, or folate. So speaking to vegans having nutritional deficiency issues, I think this is actually an issue we all have to be thinking about. Okay. And just again, quick service announcement, just ultra processed foods are the things that we should be limiting in our diet. I just want to highlight the Environmental Working Group. This is such a phenomenal nonprofit. I go to their website all the time. They have a wonderful tap water database, and they also have put forward the Dirty Dozen and the Clean 15. We're aware that there's a lot of pesticide use in our produce, and so they recommend trying to buy organic when possible, these 12 items. These are things that we tend to eat the skin of. And then these are the clean 15, where it's less critical for us to buy organic. However, recognizing that not everyone may be able to access or afford organic produce, important to note that if you were to soak your produce in a solution of baking soda, a couple tablespoons of baking soda and a couple cups of water, that will help to remove the outer layer of pesticides. So something to just keep in mind. It's something we can all mitigate. Okay, I love Michael Pollan's quote, which is eat food, not too much, and mostly plants. I'm going to shift gears a little bit now because this is something I'm very passionate about, which is really the role of physicians. What is our role in addressing climate change, sustainability, and nutrition? So there are a lot of barriers to physician-patient discussions on diet and nutrition. I think we are aware, many of you in the audience are healthcare providers, and we were raised in medical systems that have been very much focused on treatment rather than prevention of disease. We know the medical system has been set up so that the reimbursement system is really based on medical treatments, RVUs for what drugs we're giving, the time we spend, procedures. The time that we have for nutrition counseling tends to be limited. And it turns out one study showed that only 12% of office visits actually included any counseling about diet. Unfortunately, nutrition and lifestyle medicine are not emphasized in our medical curriculum. It turns out that only 27% of our US medical schools provide the minimum 25 hours of nutrition education. And it turns out on one survey, only 14% of our residents believe they possess the knowledge and training to provide any nutritional counseling. So again, these statistics are quite striking, and I think it really speaks to the need for change. I'm going to show you a survey. This is one of the Food Insights survey that was performed in 2024. And what it shows is among potential sources of food information, guess what? The most trusted sources are food and nutrition scientists, like my colleague and friend, Dr. Christopher Gardner. But the second most trusted people are medical doctors and nurses, coming right in behind the nutrition scientists. I find this striking, even above registered dietitians. So we as healthcare providers actually have we are trusted, and we need to really earn that trust. There's a huge potential for clinicians to make an enormous impact. Let's do a quick thought experiment. So let's say the average clinician has a patient panel of about 1,000 patients a year. Each of those patients eats 3 meals a day. So when you do the math, that means the potential to influence over 1 million meals a year. The other good news is that most patients are actually eager to eat sustainably, and it turns out that 59% say that sustainability is important in their food choices. Another study, which was very heartwarming to me, is that 78% of patients actually stated they changed their eating habits as a direct result of conversations with their physician. And I can personally attest to this statistic. I can say that I have had so many patients that have said to me, sadly, they say, Dr. Katsumoto, you're the only doctor that talks to me about diet, which is a problem. And then they say to me, I'm so glad that you did. And as a result, I get messages saying, Doctor, I have given up beef, or I've really cut back on beef, or they send me messages and they tell me how they're progressing. So I want people to recognize the power that they have because of your relationships, your trusted relationships with patients. They are looking to you for advice. I love this website. Check out plateforplanet.org. Stephen DeVries, Walter Willett put together this wonderful sustainable diets module, which is a really quick 10-minute, high-yield interactive guide that I think is good for both physicians as well as patients. And one of the slides from that module says, here's the reason why we need these changes, is that a serving of red meat generates 180 times more greenhouse gas than a serving of beans. I tell my patients this quote, and they are often just wide-eyed and their jaw drops. Again, these are impactful statements. So kind of following along those lines, I wanted to share with you the top line results from a study that we recently did called the PLANT study. Get this, providers learning about nutrition together. So this was a labor of love, a wonderful collaboration with my wonderful colleagues and friends, Dr. Neha Shah, who's a rheumatologist and integrative doctor, and Dr. Miriam Makowski, who's a nutrition scientist. And together, we put together a study where we hypothesized that healthcare providers exposed to a 6-week nutritional educational intervention on whole food plant-based diets would be more likely to adopt a whole food plant-based diet themselves, and importantly, feel more confident in recommending it to their patients. So here's the study. We recruited 102 healthcare providers, randomized them 1-to-1 to an early intervention where they got 6 weeks of education, or a late intervention group B where they had a delayed intervention. And we took our primary endpoint at week 6. We performed surveys every 3 weeks. And let me tell you just the top line results. 102 healthcare providers enrolled. I will tell you they enrolled within less than a month. There was a lot of excitement about this study. And the 6-week intervention that we did, it was so each week we had either a didactic session or we even included 2 cooking classes. So we did some culinary medicine, which was a lot of fun. And the promising results is that we did, in fact, see a significant increase in the readiness to change to a whole food plant-based diet, as well as the level of confidence to discuss whole food plant-based diets with patients in our early compared to our delayed intervention group. So very promising. So we are currently now working on scaling this study to reach a broader, more diverse set of providers and creating educational resources for both providers as well as patients to make this a lot more accessible. So let's jump into the kind of hands-on strategies and resources to help promote plant-based diets. So, what can we do as physicians and healthcare providers? I think it's important to think about our power in terms of having these relationships with patients. I spend a lot of my time in clinic. This could also apply to time for hospitalists that are in the hospital. I think it's really important that we focus on the fact that this is a win-win for patient as well as for planet. I think Ulka did a phenomenal job of just showing how impactful our food choices are in terms of the environmental impact. And I'm hoping that we've both convinced you of how the health benefits are irrefutable. So I'd like to model and share personal experiences. Obviously encouraging patients to really diversify their plants that they eat, sharing some cultural stories. I will often tell patients, I'm of Japanese American descent and I love my white rice, but I try to then I start now incorporating more brown rice and I mix up the white and the brown to kind of get me more towards the whole grain. Giving examples of other fun things that are cultural foods. I love making tofu in different ways. So thinking like that, I think it's fair to share these types of experiments. Thinking about traditional culturally appropriate meals that are relevant. There's a wonderful website called usapulses.org. It's got a lot of cool ways of preparing beans and, other lentils, things like that. Old Ways is another great website. And then, of course, USDA My Plate. Just reminder, in our workflow, we do screen everyone for food insecurity. So just kind of keep that in mind as well, something that's very important for us to be aware of as physicians. Just real quick, mentioning that I'm actually collaborating with a wonderful group of cardiologists at Stanford. And with them, they have created a nice epic survey that can be given to patients before their clinic visit based on the Life's Essential 8 questionnaire. So this encompasses the 6 pillars of lifestyle medicine and a couple of other things. This is, again, very busy, but it does have a very kind of top line dietary survey that I think is going to be very helpful. We can then get this data and incorporate it into our clinic visits. I want to remind people about motivational interviewing. And this is something that I think is relevant if you're a clinician in the audience, and even if you're not a clinician, I think this is relevant to how we talk to friends and family and colleagues, etc. So just the quick overview, motivational interviewing is a person-centered approach for behavior change counseling that specifically focuses on collaboration with the individual to really engage with them and to strengthen their own motivation for change. I think a very simple way to look at this is change talk versus sustain talk. So sustain talk in red is a type of discussion where it basically strengthens the status quo. So these are things that are said that really kind of are not encouraging change. Change talks are things that we can say that really help to motivate and increase the likelihood for someone to change. So let me give you some concrete examples here. So let's say someone says to you, I'm telling you, dieting just does not work for me. So that's a great example of sustained talk. And instead of answering in red, why do you think it doesn't work for you? A better answer in green would be change talk. Well, tell me some things that have worked for you, and to really get people thinking about, beyond their little fixed mindset. Someone might say to you, well, of course I want to change. I'd love to lose weight. So that's a great example of change talk. So instead of saying, how come you think you can't do that, right? A better answer might be, well, what makes it important to you to lose weight? Encouraging someone to really think about why they might want to lose weight and change. Someone may say something that is a combination of change and sustained talk. So I would love to lose weight, but no diet I've ever been on has worked. So instead of saying, well, so why don't you just try this new one? Instead, a better answer might be, of all the diets you've tried, which ones seem to be the best fit for you? So those are some concrete examples of kind of how this motivational interviewing could work. One thing that many of you are probably familiar with is a SMART goal. And I encourage everyone to think about giving a plant prescription. SMART goals are specific, measurable, attainable, relevant, and time-bound. So an example of a positive nutrition goal I might make with my patient is, I will add 1 cup of berries to breakfast, a small orange with nuts for an afternoon snack, at least 3 days a week. And that fits all of these 5 criteria as a nice, smart plant prescription. I think that Cindy has kindly put a lot of these resources in the chat, but again, here are some QR codes. Important to encourage our patients and our friends and family to learn how to read food labels, and this is a nice module speaking to that. I love the American College of Lifestyle Medicine. They have a food as medicine module that's really kind of a one-stop shop that really gives real good tips and tricks on how to start these changes. There was we discussed You Are What You Eat. Game Changers is a great documentary on Netflix for the athlete, the person who's trying to bulk up and thinks they need to eat a lot of meat. I recommend this movie. Forks Over Knives is a classic one. What the Health is a really good one for people that are struggling with health issues and want to get better. There's a bunch of websites I know that are in the chat. And then let's not forget the SNAP program and the WIC program for those who may have issues with food insecurity. So let's just give a few final tips for shifting towards a plant-based diet. Really, the goal is focusing on adding more plant-based foods to your diet, not focusing on what you may be giving up. So crowding out animal-based foods. I'm going to give a real quick, highlight of the American Gut Project, which is a healthy microbiome, was found in patients who ate 30 or more plants, different types of plants a week. So that's another fun thing that I challenge my patients to do is try to eat 30 different plants a week. And that actually is a helpful guide. Make swaps that are very subtle. So, if you use dairy milk, again, try to choose a plant-based milk. I encourage soy milk or oat milk. Butter can be swapped out for vegan butter. There's a lot of good ones out there. Try to recreate your favorite meals using plant-based ingredients. So, instead of using the beef burger, let's try a plant-based Impossible or Beyond burger. Or, I use a lot of if you want to use like ground beef in your spaghetti sauce, for example, you can use the plant-based ground beef as an option. Just start with one meal at a time, so very incremental. Someone that is used to eating bacon and eggs every morning, why not try, steel cut oats and berries and nuts and plant-based milk? Try to do the oats as organic, important to mention. And then try Meatless Monday or try plant-based at home. These are a couple of tips and tricks. And then just real quick, I want to remind everyone about the climate impact of food waste. This is something that is embarrassing, and this should not be a problem. But the problem is our United States, we waste 40% of our food, which could feed a huge number, millions of our food insecure people. And globally, the stats are not much better. So 30% of food is wasted. And it's shocking to know that food waste accounts for about 10% of greenhouse gas emissions. So, all the rotting food in the landfill giving off methane is a huge problem. 95% of food scraps get sent to landfill instead of compost, and it generates methane, which is 28 times more potent than carbon dioxide, or even more potent. And as Ulka mentioned, one of the key things we're going to really need to cut back on quickly is methane, because that's going to be our quick way of bringing down our greenhouse gases, because methane has a shorter half-life than CO2 does. So if we can act on this, it's going to have a huge impact. So again, encourage all your patients to compost. And just remember that food waste represents wasted water, wasted energy, fertilizer, pesticides, and so many other resources. So some quick tips on that are plan your meals. Don't buy more than you need. Get creative with your leftovers. Compost. Use those green bins. Take those event leftovers to food insecure people if possible. So I'm going to just end with some final thoughts. We are all in this together, and we can help fight this incredible epidemic of chronic disease by choosing to eat a more whole food plant-based diet. Just as a reminder, remember that healthy plant proteins, legumes, and nuts should be emphasized, that fiber, which is only found in plants, is really key to maintaining a healthy gut microbiome. I want to mention that it also may help with detoxification. But it's really a key thing that so many of us are missing in our standard American diets. Whole grains should be prioritized over refined grains, and ultra-processed foods of low nutritional value should really be limited if possible. I want to mention that we vote with our forks and our spoons every single day. And so as such, eating a more sustainable whole food plant-based diet is good for our health and good for the planet. It is a win-win on both fronts. And so with that, I just want to say thank you to my patients first and foremost. They have taught me so much. Thank you to Dr. Ulka Agarwal for inviting me to join her in this presentation today. The plant study team, my dear friends and colleagues, Christopher Gardner, who's also a dear friend, colleague, and mentor, my family, friends, and colleagues who've supported me, and mostly thank all of you for being here today with us. I want to say thanks for your attention. Any questions? And before we take questions, I want to show a QR code for filling out a survey, if you don't mind. So I'll leave that up there, and then we can kind of shift over. Great, thank you.
That was fabulous. Thank you so much, Tamiko. I mean, both of you, this is such a wonderful resource to have both of you in the same webinar, and the information is just, it's so comprehensive and explaining things. And it's so often we hear sound bites about food and, you know, what is good, what is healthy. And you've just really explained it in a really nice way. Wonderful presentation. I really appreciate it. Both of you did a fabulous job. And, you know, I want to let everybody know that this is recorded. It will be on our website in the environmental health page. And the resources will be listed with it. And also, we had some questions about the resources there. So we will be sending you the information. We're going to go ahead and start the Q&A. And I'm going to start, there's several questions. So one question is, and you both can decide who to answer, you know, who answers. Our new director of HHS, RFK Jr., is excited to start frying everything in beef tallow instead of seed oils. I wonder how this change in fast food restaurants alone will increase disease and greenhouse gas emissions. So I wasn't even aware of that.
Ulka, why don't you take that one?
Sure. Okay. It's mostly a distraction. I mean, fast food fried in beef tallow is still fast food that's fried. So that's the bigger picture. And the fear with that is that people think they're eating healthier, and so they may increase their fast food intake, which is taking the place of whole plant-rich foods. So, you know, whenever people say, is it healthy? Well, what do you mean by healthy? Because do you mean low in saturated fat, high in fiber, low in cholesterol, packed with antioxidants and nutrients? Because it's not. So what do you mean by healthy? So that's an important thing to kind of look at. What are you comparing it to? In terms of environmental health, I think beef tallow, I believe, I don't know too much about it. I've also kind of been reading a little. I believe it's a byproduct of the beef industry. So I don't know that more animals would be raised specifically for it. I think it's beef that would have been waste anyway. I don't know how much energy or resources are used for processing. But it does keep the beef industry going. Just like veal, you know, the dairy industry keeps the veal industry going. And so it is something to think about is it's just, we need to be moving away from meat-based foods. And I think the important thing is French fries are still French fries. And we want to be generally moving away from processed foods.
Great. And do you want to answer that, Dr. Katsumoto, or, okay.
I just typed something in
Comments?
the chat about
Oh,
the
you did,
seed
okay.
oils, and I would recommend, Christopher Gardner has actually spoken out about this. And really, I think there's been so much noise. I mean, there's just so much distraction there. Beef tallow is not healthier than seed oils. So he's just, again, he's a PhD nutritionist, so I would trust him over RFK any day.
All righty, thank you. And next question is, given people's desire to eat meat, what is your thinking on lab-based meat options currently under development? There's still concerns about energy needs, antibiotic use, acceptance. Several states have already banned lab-based meat.
Do you want me to take that, or do you want to take it?
Totally up to you. Go for it.
Okay. I mean, we could both share our thoughts. I think there's about 150 companies around the world maybe working on cultivated meat for beef, pork, lamb, and fish. I believe there's 2 companies in the US that happen to be in the Bay Area. I think it's Berkeley and Alameda, Upside Foods and Good Meat. I think we're just recently green-lighted by the FDA to now produce and sell cultivated chicken. I think Singapore's already doing it. I'm not sure. I think it's chicken in Singapore. And so, you know, I think it's hard to know. I mean, they have done some studies. Some say that it's less emissions, some say it's more, and I think it depends on, the methods that you're using for processing, where you're producing your energy. But I think anytime you scale anything, potentially, you're gonna have more emissions and energy. So that's something that will have to be optimized. Um, but it is meat, and so I think it's hard to know, and I think there needs to be more research. The good thing that I take away from it is that we are actively looking for solutions, that we've acknowledged the current food system is not sustainable the way it is. We know that it's going to grow by 80% by 2050. We cannot do what we're doing. Even if we don't like cultivated meat, we've got to do something. And it's not the current system.
And I totally agree with that. I think it remains to be seen the cultivated meat, like you said, the greenhouse gas impact. I think the plant-based meats are good options. As Ulka said, I think they are important stepping stones. And actually there was an issue that came up recently where I saw a talk where they said, oh, plant-based meats, like Impossible makes soy-based meats, and it's a huge problem in terms of glyphosate. And actually, I'll tell you, I learned that when they do their processing of the Impossible meat, there's a hexane extraction phase where they take out the glyphosate. So it's actually interesting that it may not have a lot of the bad contents that we think. So again, I think it's there's never an all or none answer here. And I think the whole ultra processed food field is also very confusing. I think the science remains to be worked out. I mean, we're not going to be able to get rid of it entirely. And I think that we have to understand the NOVA classification, I think, is still the best, but not adequate to speak to the health risks of ultra processed foods.
And your colleague, Dr. Gardner, actually, he's on the advisory committee for the dietary guidelines, and they actually didn't comment on ultra processed foods because there's no agreed upon definition. Like, I'm kind of Googling what's the difference between ultra processed and processed. We all kind of don't know, and so there's no agreed upon definition, and there's just not enough research right now. I mean, some studies have made the headlines, but it's not the whole story. So we all need to stay tuned and just kind of do the best we can until then. Of course, we all want to make our own food and have whole foods, plant-based foods, but we also have to meet ourselves where we are and just do the best we can. Just make the next best decision we can and go from there till we know more.
Exactly. And I'm looking at, I think Mohan asked the question about the whole fake meat ultra processed. So yeah, and this is exactly what the beef industry is using, right? As their argument to not eat ultra processed, to not eat plant-based meat is it's ultra processed. But Christopher Gardner did a beautiful swap meat randomized trial. It was actually where he actually did a crossover trial, and it was just so clear the cholesterol, the lipid profiles improved on the plant-based meat. So there's clear biomarkers that are that we know are associated with better cardiac outcomes that were associated with plant-based meat compared to regular meat. So
and that meta-analysis and systematic review that just came out in February of this year included two studies from the swap meat trial. It was of 7 clinical trials using plant-based meat alternatives. And they found that actually the plant-based meat alternatives compared to conventional meat reduced total cholesterol and total body weight. And so this was though in healthy adults, and it was up to 8 weeks, but initially that was pretty encouraging. So we just need more studies that are longer term and in adults who have maybe cardiometabolic risk factors. But exactly like Tamiko is saying, that they're, it's not clear that they're necessarily harmful.
Right. But still, we don't know. So there's probably more than just cholesterol. You want to know if there's other toxins. How do they process it? Are there heavy metals? I have no idea, but sometimes you do a study that's short, and what we've learned so much in our environmental health committee and studying toxins is that you don't know until you do the right study. If you don't look, you don't find, and so you really need more studies. So, all right. So we have another study. Somebody asked, a patient today told me she heard a nutrition talk. She needed to get 100 grams of protein a day. She wasn't happy telling her that 1 gram of protein per kilogram per day was sufficient. That is about 50 grams. Why is there so much misinformation about protein needs?
So I think this is a, again, hotly debated topic. I think that there's actually interesting data also on the opposite. So there's a wonderful scientist named Walter Longo who is very much interested in longevity. And he argues that there are actually liabilities for eating too much protein, in terms of not only, shortening your lifespan, but also increasing your risk for cancer. He talks about the fact that protein induces upregulation of IGF-1, which is insulin-like growth factor 1, that is known to play a role in cancer generation. So, I think that there's and then of course we worry about fragility and sarcopenia, which is loss of muscle. So I think that the truth lies, again, who knows everyone is different, stage of life, what your body type is. If you are truly an ultra athlete, then, your protein needs are going to be high. But let me tell you, a majority of people are not ultra athletes. And so I think, people are quoting them, protein goals and targets based on weight. One of the big things that I've struggled with is I've heard people quote based on what their weight is, and if they're overweight, it's not ideal body weight, right? And so I find that to be a problem as well. So I think that unfortunately the obsession with protein continues. I know there's a bunch of influencers out there, but I think we need to kind of go back to the science. And again, Christopher Gardner, hate to sound like a broken record, but he gives probably one of the most cogent talks on this topic, as an informed nutrition scientist.
Great. And do you have any other? So we have more questions here there's some questions about children and kids, how to get little kids to eat green veggies, and any resources that you might have regarding getting kids to eat plants.
Oh, go ahead.
I'm going to give a shout out to a good friend and colleague, Reshma Shah. Dr. Shah, Reshma Shah is a pediatrician. She wrote a book that was called Nourish, and it was very much focused on plant-based eating, focusing on, kids in particular. So I think she has a lot of great tips and tricks up her sleeve. Things like making baked kale, right? Things like that might be a yummy way of incorporating vegetables into their diets. But I know it's challenging. So again, I would defer to people like Reshma. And Ulka, go ahead.
Oh, no, that's wonderful. Yeah, I was just going to say, I mean, there's like Physicians Committee for Responsible Medicine, or PCRM.org, has a lot of free information. They have a whole campaign on like healthy school lunches and nutrition for kids. And so you can just go to PCRM.org and get lots of great information on creative meals, and like a green monster smoothie that's bright green that kids, love to drink, and kind of introducing them to some of the healthier foods.
Right. And so somebody points out, I thought it's a good comment, that several years ago, the UCSF hospital cafeteria reduced content of its standard beef burgers by incorporating a large portion of mushrooms into the meat. And the new burgers were so delicious, they sold a lot more of them. They had to increase their orders of beef. Great decrease, probably, their orders of beef, a great learning experience. So yeah, mushrooms are a good substitute. Another question.
Can I add
Yes,
something to that? Because
absolutely.
there was a question about, how can we increase more plant-based
Yes.
foods for patients in hospitals? And there's so much research coming out about plant-based defaults now. So like all 11 New York City public hospitals offer a plant-based dinner option as the default dinner option. And then you can say yes to it, or you can say, no, I want the meat-based option. But about 80% of people, 80 to 90% of people, because we're human and we're like, okay, I'll just go with the status quo, they'll just accept the plant-based option. And so it's interesting that, if you told people, if you offer them the beef burger and said, do you want the mushroom? People would just get the beef because that's what they're used to. So this is one great strategy of not limiting anybody's freedom of choice, not telling people you can't eat something. But if you offer it to them first, they're more likely to try it. And that's a really creative way of just kind of being more inclusive, but also getting people to try the plant-based option. They've done like to be a donor, for example, when they did an opt-out, more people were agreed to be donors. Or they did a study with physicians where, they have physicians were not ordering generic medications. And so we were in the electronic medical record. They were just ordering the brand names. And so then when they would default it to the generic name, physicians just said, okay, accept. And so just by default, we'll accept what's offered to us. So that's a way of increasing plant-based options.
Great. And we have just a little more time. There's a couple of questions. One was about soy, and if it's a myth that there's any problem with soy causing hormone imbalances in humans, and another one on oxalates in food. Plant-based diet, you have to worry about oxalates. So do you want to answer the soy causing hormone imbalances in humans? Is this a myth? Because I've heard this as well.
So I think my understanding, so soy is again one of the good foods that I think unfortunately has gotten a bad rap in some circles, but the science, I think, there's just so much epidemiology that suggests like, Asian countries that eat a ton of soy, like there is lower rates of breast cancer, lower rates of, these hormonal issues. I think that, when we think about hormonal disruption and we think about all the endocrine disruptors in our environment, I think those are the bigger problem, honestly. But I think the whole soy as a big issue has been mostly debunked. I think that a lot of the studies are based on animal studies where they were using supraphysiologic doses of soy proteins that were just not even what someone would consume. So I think that has been a problem that has stayed on and given it a bad rap. And again, I think the beef and animal ag has jumped on that and brings it out as one of their weapons to fight eating plant-based. Ulka.
Great.
Yeah.
And how about oxalates? Because I know I've read this too, with charts. Some certain foods have a lot of oxalate. You have to be careful about doing this when you eat smoothies. Any comments on oxalates?
So I think there are some anti-nutrients in some foods. So, people talk about oxalates, in spinach, things like that. But again, I think, people talk about lectins all the time. There's this whole discussion on lectins being a problem, but it turns out when you cook lectins, they often then are no longer an issue. And so I think that it's all about not over-consuming, the oxalates. I think if you have kidney stones, you do need to be cognizant of not eating too many foods that are high in oxalates. But in general, again, eating a diversity of foods, balanced, not overeating any one type of food, people are fine. It's not a problem.
Okay, and I think I'm just encourage everybody to use the Q&A also. And we're just gonna, I think we're maybe one more, was a couple of them that are good. I want to ask, one asks if there is educational programs or curriculum on plant-based foods for primary school students in the area. The earlier we can get the children to advocate for plant-based diets, the better.
There's a
Are there?
lot of interest in this. And I know that, I grew up in the East Bay, and Alice Waters, who runs Chez Panisse, was really huge into school-based, gardening and getting the kids involved. So I know Christopher Gardner actually also runs a summer program focusing on kids and nutrition. But I know there's a lot of groups that are trying to do this. So I would love to see that scaled. And really, again, starting early. I mean, I just think about when we look at our kids' menus and we see all the mac and cheese and the chicken and fries and us, it breaks my heart. Like this terrible food that we're starting to feed our kids so early on.
Exactly.
So it's a huge issue. Yeah.
Yes, and I think we're really at the end of our program, and I'm sorry we don't have a chance to really answer every single question, but you all have done such a wonderful job. I want to point out this is recorded, and it's going to be available on the website. And look forward to April 22nd, when Dr. Pandapati et al. Are going to talk about discussing climate change with patients and doctors. It's going to be a wonderful talk. So thank you both very, very much. And thanks to all the attendees. Thanks for all your wonderful questions. And we will provide the resources. If you have any questions, you can, of course, email Emily Corin, but we will provide it. I think she's going to be sending an email out with all these resources and other questions, how to contact Dr. Agarwal and Dr. Katsumoto. So you can contact them if you wish. Thank you so much. Good night, everybody.